Hello, I'm Matthew Houde, Vice President of Government Relations at Dartmouth Health. On behalf of the Office of Government Relations and Dartmouth Health, I'm pleased to welcome you to the We Care, We Vote Health Policy Grand Round Series for 2022. We Care, We Vote is a nonpartisan voter education initiative designed to encourage participation in the upcoming midterms by providing information on registering to vote and voting in New Hampshire and Vermont. For more information, please visit the Government Relations website. As a 501c3 organization, Dartmouth Health can't engage in election intervention activities. In other words, we don't tell people who to vote for. But we do invite in all candidates for conversations to learn where they stand on the issues and an opportunity to ask questions through Health Policy Grand Rounds, which is modeled on our clinical Grand Rounds. Last week, we had a conversation with candidate for Executive Council District 2, Mike Cryans. Welcome, Mike.
Thank you, Matt.
So, Mike, maybe we start out if you could tell the audience about yourself and in particular the role of the Executive Council in New Hampshire government.
Well, first of all, thank you for inviting me and the DHMC family. The Executive Council is probably one of the most unknown elected body in probably the whole country because we're the only ones that have it. We are a check and balance on the power of the governor, and all of the contracts that are put out by the state go through the Executive Council. All the appointments that the governor makes to either major appointments for running DOT or the Attorney General, any of those positions, but also the boards, the volunteer boards and commissions. In addition to that, all of the judicial appointments go through the Executive Council. And probably the one area that most people are unfamiliar with as far as an Executive Councilor, how I view it is we are the eyes and ears for the residents of the district back to Concord. So constituent service is very important to me. I grew up in Littleton. I was born and raised there. I went through the school system and then went off to Springfield College. I landed a job teaching back at the high school that I graduated from in Littleton, taught for 5 years and then went into banking, and that's what brought me to Hanover. Actually, I've lived in Hanover now for the last 40 years. And after that, after banking, I did some financial work and then finally ran a nonprofit called Headrest that deals with substance misuse and suicide hotline. During my time at Headrest and some of my financial work, I was also a county commissioner for Grafton County. Grafton County is the county that's north of Sullivan County and runs from basically Lebanon all the way up to Littleton, Franconia, and Bethlehem, and back down to Plymouth and Ashland. It's area-wise pretty good size. So I did that for 19 years as a county commissioner, and during the time I was a county commissioner, we built a new jail. We made a major addition to the county complex, and we also started some programs, mental health court and drug court, which hopefully will help people not go into the state prison or a county jail and actually help them follow a path of clean and sobriety and make them productive members of society again. So I think I should mention I have wife Julie and two sons, Cameron, who lives in Colorado, and Connor, who is at home right now getting a master's degree through UNH in public administration. With Cameron out in Colorado, I have two grandchildren, Gavin, 14, and Leah, 12. And hopefully that gives you a little thumbnail sketch of me and what I've done in my work life.
Great, thank you. So this is an opportunity actually that I'm going to take advantage of to talk about some of the unique features and interrelationship of New Hampshire government for our viewing audience. So there's the county commission, and then there's the county delegation. And so could you talk about the interrelationship between those entities?
Sure. The county commission, each county has 3 county commissioners. So no matter the size, whether it's Hillsborough, which is the largest county, or Coas, which is the smallest, each county has 3 county commissioners. Where it differs is not each county has the same members of the delegation. I believe in Coas now it's down to 9, and probably 100 and something in Hillsborough. So it's all driven by population. The county is basically on a day-to-day is run by an administrator, and we sort of serve as the county commissioners as a board of directors over her or him, whoever's running it at the time. But in addition to that, you have the delegation, and the delegation is made up of your House members from your towns and cities throughout your county, and their main task is to vote on the budget. And so once the budget's passed, the county gets it back, and we run the county on a day-to-day basis like that. But they also have what's called an executive committee, and they certainly, it varies from county to county, but in Grafton County, once a month, they would meet to make sure things were going well.
So can you serve as county commissioner and executive counselor at the same time?
You could until Ray Burton died. And once Ray Burton died, they passed a law saying, make your mind up, you choose one.
Okay.
So I was a county commissioner for 19 years, and so I chose to run for the executive council.
And there are 5 executive counselors for those that don't know, so it's an elected position. We're here for we're here in the context of a primary election contest that's September 13th in New Hampshire. Could you talk a little bit about your district and the size of your district? Because for 5 across the entire state, what that might look like.
So each executive counselor has a population of roughly 270,000 people. And you do the quick math, and that means the state population is about 1,350,000. In addition, it takes a big size. For instance, the districts of 1 and 2 are huge districts. District 1 used to have 108 towns and 4 cities. It's changed a little, so I won't get into that. But District 2 has, as you mentioned in the intro, reconfigured. So 44 towns and 2 cities came from District 1, and 30 towns and 2 cities came from District 2. And then to make it even a little more complicated, they pulled out Peterborough and Sharon and Bow and threw them in. So the new district is made up of 81 municipalities. Of those municipalities, 4 are cities and the rest are towns. And some, as we all know, because some of you that work here, I'm sure, come from very small towns, and some probably come from much larger towns. The role of the Executive Council, do you want me to spend a moment on that? The role of the Executive Council is to sit with the governor. The governor develops an agenda. So for instance, sometimes somebody will say, oh, I wish you would have nominated so-and-so to be head of such and such a department. That's not the role of the Executive Council. We can make recommendations to the governor, but the governor ultimately makes that choice. So there's an agenda. Sometimes around this time of year, you might have 100 agenda items. As you get near the end of the fiscal year, usually the end of June, you might have 500 items. So it's a busy time because many things are wrapping up to close out the year and stuff like that. The agenda items also include in those items sometimes some huge events. Medicaid is a huge one. And then you have some where you might say, well, I know an agency, I'll pick on headrest. They get a couple $100,000, or some might go as low as $10,000 or $20,000. So it's that kind of dynamics. One of the things that probably I gained the most notoriety, in fact, I think I might be the only one that I know in at least recent time who had a cartoon made up about me and Gordon MacDonald and the governor when I called the governor and told him that I was voting against Gordon MacDonald. There was a cartoon that played in the paper. I won't go into all the details because we don't have time, but it was sort of memorialized me in that regard.
So to recap, just for some of the viewers, so we have the Executive Council is a 5-member elected body. The geographic terrain stretches depending upon where you are in the state. The North Country is obviously fairly large. My understanding is the newly configured district goes from Keene up to the Upper Valley and then across.
No, actually, Matt, it goes from Keene, well, there's a couple of little towns, but let's say Keene, all the way to Littleton,
Littleton.
Bethlehem, Franconia, and Carroll, where the Mount Washington Hotel is, back down through the Notch into Plymouth and Ashland, and then across into Canaan and Enfield, and then back down to Concord, Canterbury, Warner. I mean, it's
Wide swath of the state.
I mean, I guess the best term you could say is probably gerrymandered.
Fair enough. And you approve contracts that are over $10,000 in value, and so that could be anything from literally $50,000 contract to the managed care organization contracts, which are hundreds of millions of dollars for the state of New Hampshire, as well as certain gubernatorial appointments.
Yes, all of the major department heads go through the, and that includes, some that are called directors, and some that are called commissioners, and some at the, like a department like Health and Human Services comes down for some of the other levels. Not every department's that way, but in some of the bigger departments it is.
So that's a fairly substantial and somewhat unique check on the governor of the state of New Hampshire.
Yeah, because for many people, they know the governor goes in, the governor says, you're going to be my attorney general, you're going to be head of Health and Human Services, you're going to be head of DOT. That happens, but not in the state of New Hampshire. In fact, the interesting thing in New Hampshire, quite often the nominee, and finally when they're approved, will outlive the governor as far as not living longer, but outlive him as far as their term. Because the governor could be done in 2 years or done sooner than that, and they might get a 5-year appointment. So
I'm going to jump into some questions now, if I may. As we continue to navigate the COVID pandemic and work to resume, some normalcy, we, healthcare providers, are still experiencing constraints that COVID-19 either highlighted or created. New Hampshire, for example, is experiencing constraints with respect to housing, with respect to workforce, childcare, staffing, I mentioned, in most industries. If you're elected to the Executive Council, how will you work to support and expand workforce capacity for the state?
Well, it's been, even before COVID, it's been a big concern of mine because I've always been concerned about the exodus of young people. I think my time on the county commission sort of was like a little microcosm of what happens in a big entity like DH. It's a struggle. We have, as you know, housing issues are tremendous. There is $100 million coming back to the state to be put into housing. My great wish is it doesn't get put into a few or several major developments in the southern part of the state. I hope they spread it around, because this is not just a southern part of the state. This is an entire state issue, housing. You talk to anybody, it's amazing the travel people put in. And we know what the rising cost of gas, what that's doing. So I think you always have to have somebody that's at the table that is cognizant and aware of the struggles of people that are working day to day, paycheck to paycheck. I'm always haunted by that statistic I've seen numerous times where it says that around half the population couldn't come up with $400 if they had to. I mean, statistics like that are scary, because if you're traveling from XYZ town is 60 miles away and your car breaks down, you don't get to work, and usually your car doesn't break down, it's less than $400. So, I mean, there are all of those kind of struggles. So I think, none of us know how this will all play out, but I think that first and foremost, you have to be concerned about workforce and housing, transportation, and affordability of all those issues. So I don't think I could tell you a specific thing that might come before the council. I hope we continue to take money from the federal government. I know some of the councilors I've seen have balked at taking additional monies, because I think even though we are starting to work our way through, there's no way have we worked our way through it. And to tailor make it and talk specifically about the hospitals, when I was on District 1 Executive Councilor, the state, I think there's roughly 30 hospitals in the state. 12 of them were in District 1. And we have the very smallest, up in Colebrook, and we have the very biggest right here. So, it's, and when it's shut down, what's the first thing? You can't do surgeries, you can't do that. It affects your bottom line. So all of those things, I think we have to continue to take money in. We have to be concerned that we don't go into into a recession, because that could be a big issue as well.
So it's going to be interesting to see, because we've certainly had challenges as one of the healthcare providers in the state in terms of preparing for the surge, shutting down elective procedures in order to make room for a surge, and then caring for patients with COVID, and all in a developing environment that certainly had financial ramifications. There was certainly federal dollars to support hospitals in those efforts. But to your point, we don't expect to see a considerable amount more of federal aid in that space, though there is still federal dollars for housing as part of the previous initiative on the federal level, as well as what we might see in terms of broadband and infrastructure dollars. And so my understanding of how the council works is you would have to approve contracts that would come into the state, even though they might be governed or administered by, say, Health and Human Services or a different department. Do you have a sense of, not knowing necessarily what those contracts will be today, do you have a philosophy or an approach to how you navigate contracts that come in to your desk?
Well, my biggest concern always is that we take care of New Hampshire first. I mean, I've always been concerned about, there was a famous contract that they wanted to farm it out to Indiana or something, and so I think I've always felt that we do New Hampshire first. But when I was dealing with the hospitals, I know Dan Jansen pretty well. I called Dan because I appreciated his perspective, and
just so everyone knows, Dan's our CFO, Chief Financial Officer,
yes,
here at Dartmouth Health.
But I've known Dan for years because he was a boss and one of my running buddies, so got to know Dan that way. But I appreciate his perspective, and I think when you see what potentially can happen to a hospital, and let's just take DH out for a second, and you look at some of these small hospitals, they are quite often the biggest employer in their community, even though they're small. They're the biggest employer in the community, and they rely upon a certain revenue coming in to keep the door open. And so obviously I was very concerned when I saw that being shut down and people being turned away, because it's nice to get the money coming in, but we also know that people were passing on getting surgeries they should get and things, and the big concern, what would happen when things abated and we were able to bring people back. And I think when you drive in and you see the parking lots here, you realize people now are coming back and wanting to get those things done. So I'm without trying to answer a specific what happens this or that, I feel that we have got to do something for the hospitals, because they are so integral to our communities. And if you start adding up all the employees of hospitals, it's a huge number. So DHMC is one of the most rural, if not the most rural located academic medical centers. So to your point about location in former District 1, now District 2, there are, I think, challenges unique to a rural academic medical center. Among them, what you've alluded to, I think, with respect to employees, my understanding is there's over 1,000 vacancies for the system. And the cost of travelers to make sure that people who are asking for those services are able to receive them. So I would echo those concerns. One of the other components about an academic medical center is its research component, and Dartmouth Health providers and researchers, clinicians, are proud to be recipients of many research grant programs, many of them federally supported, but oftentimes state dollars are allocated too.
from agencies across the government, from the NIH to the Department of Defense and the Veterans Administration. If elected, how will you review the proposed contracts brought to you by these respective agencies, and how might you decide which contracts the state should accept or deny?
Well, to sort of start a little bit before that, we are going to have a new head of DHHS, and that's going to be a major position. And that is a question that'll be most important asked to them, because as we all know, it gets to the council desk because one, it goes through the governor, but also DHHS has to be positive on what they present to bring it forward. So I will be looking at a new head of DHHS, because Lori Shibonette has thankfully given 6 months notice, which is remarkable. It's probably the toughest job in state government. So my approach would be, one, to get a good person running DHHS, a stellar person, and then in turn to make sure the contracts that come through are, I will be looking at them the clearest, those that affect my district, because I have not only you, but I have Dartmouth College. I have a number of others that are trying to get federal grants, and some pass through the state, and make sure that they're appropriate, that we can use them, and that we're not delaying them. Because sometimes I think the biggest concern has been, and I've heard in the past, is sometimes it takes too long for them to get finally approved. Because there's a whole structure how it gets approved. And it's doctors and research people are waiting to get these grants, and they survive sometimes on getting them. I mean, we all look at the good work, the results when it's done, but I think the important thing is to make sure it's done in a speedy and forthright example.
So the reason I was chuckling while you were saying that is there's the delay that's brought on by not just an agency process, by the Executive Council's review of the process, but oftentimes there's fiscal committee review and approval of distribution of funds too, which is the fiscal committee, for those who aren't aware, is made up of members of the House and State House and State Senate who also approve allocation of state dollars. So yeah, it's a unique.
It's a lot of process.
There's a lot of process in the state of New Hampshire for receipt of dollars, or distribution of dollars, I should say. So you mentioned your role with Headrest previously, and New Hampshire, by many measures, is national statistics, one of the highest rates of opioid-related overdoses. Post-pandemic, we're still experiencing high overdose rates and an increased need for treatment for substance use disorder. I was wondering if you could speak to what you would do in your role as executive counselor to ensure that people who are struggling with those behavioral health challenges get the services they need.
Well, when I was a county commissioner, we started a drug court and a mental health court, because I think the important thing is for those that are willing to take part in those programs, to keep them out of jail or state prison is crucial, because in a lot of cases, especially if you keep them out of jail, they're not there that long, and by the time they get back out, life has changed so much, and it's only a matter of time usually before they end up back in jail. So that's a big concern. The fentanyl issue has been heartbreaking. It's when you're at a place like Headrest, you hear some of the stories, or you see some of the results of what's happened with fentanyl, and also some of the other drugs. But mainly right now, the things that are laced with fentanyl has really caused some severe problems. If I've got a soft spot for trying to remedy an issue, it's that, because I look at the work that while I was at Headrest, and I'm reminded by one day I was at another agency, and this lady yelled out, "Oh, Mike, Headrest does so much good work." I said, knee-jerk reaction, "You do good work here too." She said, "But you save lives." But the next thing was the most important thing: you save mine. And I think, I was in banking, I was a school teacher. To have somebody tell you that your agency saved their life, it's pretty awesome feeling. I'm sure that, sitting here in a medical center, doctors have had that before, but, when you hear that, and or you hear I'm 10 months clean and sober. So the drug courts and mental health courts, I think, I was on the New England Drug Court Board for 8 years. And when I was on the board, at one point I was asked to give the New Hampshire perspective. And I said, I got good news and bad news. First, for the good news, New Hampshire just doubled the number of drug courts in the state of New Hampshire. Now for the bad news, we went from 1 to 2. So, but now I think almost every county but one has a drug court. So it's not to say that's the only answer, but for some counties it's been a great answer. And if your listeners ever get a chance to go to a graduation of a drug court, it is the most inspiring thing. Not so much all the stuff that goes on, but the person that speaks and just says, this is how it's affected my life. So to go back to your thing, when I was at Head, we still only get about 50% of what we do from the state. So if we do, let's say just for the fun of it, $500,000 worth of counseling, we're only getting about $250,000 from the state. At least when I was there, that's how it was working. And, so we have to raise a lot of money and do all those other things to keep the doors open. So
I'm just going to remind viewers that feel free to send in questions, and I have one here that I'm going to take, which pertains to social determinants of health. And we know that the majority of healthcare outcomes are driven by factors beyond the walls of a provider's office. So these drivers, such as housing, quality, education, social supports, income, and employment, are impacted by policy. And the question is, do you feel the Executive Council has a role in addressing the social determinants of health for Granite staters? And if so, how would you work to address them?
Well, probably, I've been on a couple of insurance boards at times, and I've often said that my biggest advocacy is for wellness. You probably don't want to hear it in a hospital setting, but and I'm joking, being like, but wellness I think is so important. So anytime we can advocate for people to be living a healthy lifestyle, whether it's not, smoking cessation programs, obviously drugs and alcohol that play a huge role. Also, thing we didn't mention is suicide. We've seen huge numbers out of suicide, and they have the new phone number for suicide. Maybe you can, I think it's 988, but instead of the 1-800-273-TALK. But I think the council can play a role, one, in advocacy. Two, occasionally there are things that come across the agenda that affect it. But it's not a silver bullet. I mean, we can't solve all of the problems, but DHHS is probably, well, it's over half a state budget, so it plays a huge role in what we can do. But to go back to your specific question, I think that's probably my biggest thing that I've always harped on is wellness. And for those people that know me, I run every day, and I'm not saying go out and go run every day, but go for a walk or watch what you eat and all these kind of things. The simple ones sometimes are at least the start.
So I'll plant the seed for two in the event of a successful campaign. One is for community health workers, who are people who are literally engaged in the community and serve as the interface to some of the challenges that people are seeing in the healthcare space and in someone's community, in someone's house, in someone's environment. I know that we've advocated for additional funding from HHS for community health workers. So if that one comes across your desk, would ask for your support. And then the other, I would say, more larger dollars potentially, are what gets built into the Medicaid care organization contracts, because I know that they're responsible for a lot of case management activities too. And I think that might be a vehicle where you'd hear from us going down the road.
Well,
Right.
and I think one thing, and I know this is the job you're in, but I think is the openness to talk to people like yourself when you come in, and because you, in a lot of cases, and others like you that do your work, are the most knowledgeable of what you do. And sometimes, I think sometimes people look at this type of job as you should be separate. But I think it's a great learning experience because, as I just mentioned, I came from a different background, and sometimes somebody can come in and talk about banking. I have a pretty good understanding, or maybe even substance misuse. But if somebody comes in and talks about something else, I might not be the best person, and I can be educated by people that do the type of work you do.
And so again, I'm going to take that opportunity as an educational moment, perhaps for the people, the employees of Dartmouth Health, the government relations team, myself, Courtney Tanner, and Allison McDonald are lobbyists. We're registered lobbyists in the states of New Hampshire and Vermont, and in the requirements in Washington. Our job is to make sure that we present subject matter experts to the elected officials and policymakers, because we don't pretend to be subject matter experts on all these topics, but we certainly do want to make sure that we facilitate the communication between our subject matter experts and elected officials. So I'll take you up on that if the time comes. So pivoting to the next question here is on diversity, equity, inclusion, and belonging. And I was wondering if you could share your views on this arena and how the Executive Council, if they can, address. You certainly know that in the budget last year, and this is not something that the Executive Council is responsible for, I understand that, in House Bill 2, there was a piece added about divisive concepts that really precluded certain conversations in the diversity, equity, and inclusion space, which a lot of organizations, including Dartmouth Health, were opposed to because we didn't want it to have a chilling effect on those important conversations. So I'd be curious to know your perspective on the Executive Council's role in that space.
Well, I would say that the easiest way to answer that for me is that we should not be doing things that preclude people from being involved, and I think it's fair to say I don't feel that I have any kind of bias or racist feelings towards people, because I think that's important to have. I don't want to see us go to a point where it all of a sudden gets people back on their heels because they feel like we're trying to micromanage how they do their job, i.e. teachers. I'd like to think I'm a strong believer in inclusion, not exclusion. So I think that's probably the easiest way I can answer that.
You mentioned education, so in your role as a former educator, what your perception of that would be? I
was not glad or happy about them getting involved. I think teachers have a tough enough job than to be hamstrung by a legislative move like that.
So I've asked you a bunch of questions, read some from the audience, but I want to make sure that you have an opportunity to share anything that you'd like to share that I haven't asked or we haven't asked. So I wanted to give you that opportunity.
Well, I haven't really thought of any great specific questions. I think the easiest thing for me to say is that, and I'll try to align it with my running, because I think it's the easiest way I can put it out there. In my running streak right now, I haven't missed a day in running in over 11 and a half years. And I want to take that same type of commitment and dedication back to the Executive Council, because I view it as a full-time job. Even though it's not paid like a full-time job, I view it as a full-time job. And the constituent service part is what I really thoroughly enjoyed. And I've used this example before. The unemployment before COVID hit was 4,000 people filing claims. Within 6 weeks, it went to 118,000 people. And as George Kapadas, who heads employment security, said, we usually have problems with about 5%. Well, you can do the simple math. 5% of 4,000 is 200 people. 5% of 118,000 is about 6,000 people. So you have a lot of issues. And a lot of people never thought they'd be on unemployment. And to know they had a voice at the Executive Council that would follow through and get them their they're due, as I always looked at it. And the one example I use is I get a call from someone one day who said that she had no money coming in, she had filed for unemployment, no response, it wasn't working, and that she was a mother with 2 kids and no family resources and no friends to help. What do I do? So I got on the phone and worked with her, and I said probably the most high lifting moment that day was coming home and hitting the answering machine and hearing her say, "I got my check." And somebody said, "Who was?" I said, you don't care who it was. It doesn't make any difference, Republican, Democrat, Independent, or not, it doesn't even vote. It's the idea that you need somebody there that's going to champion your cause. So there's a simple little one, but I think for me, it's who I am. I want to make sure that people that need the executive council or need the counselor, because we are the eyes and ears for 270,000 people, we will be there for you. And so that's probably the easiest way I can sum it up for me.
Great. Well, I'd like to thank you, Mike, for coming in to talk to me and to talk to our audience. I'd like to thank you for watching. And don't forget, primary is September 13th in New Hampshire. And thanks for joining us.
Oh, thank you.